Danielle, I would love to welcome you here. Danielle is our Slade professor, as well as the executive director of our Center for Health and Business here on campus. We are so happy, Danielle, to have you moderating this conversation, given your expertise in this space. And so I would love to hand the floor over to you.
Hey, great. Thank you so much, Emma, and welcome everyone. I'm equally as excited to be here and learn from our panelists, Dan and David, who I'll introduce in a second. I think one of the really amazing things about being at Bentley, I have a background in psychology and public health, and I've thought a lot. My career has been around kind of how do patients interact with the healthcare system? And AI, as we know, is changing so many aspects of that and has the potential to change so many aspects of that. And so I've been studying that from the research perspective and from the patient engagement perspective. And I'm always just so incredibly excited to learn what folks out in the real world, outside the walls of Bentley and outside that kind of research environment, are doing to think about these questions and implement and drive forward the use of AI in health and healthcare. And so we have two amazing panelists today, Dan Karen and David Crosswhite. So Dan is the CEO and founder of Health Universe, and David is the founding team member of Renaissance Strategy. I would love for each of them to have a chance to introduce themselves and talk a little bit about how Health Universe and Renaissance Strategy and other things they've been involved in think about AI in healthcare. So David, I see you're unmuted if you'd like to start.
Oh, okay. Well, good afternoon, everybody, or good morning, depending on where you are in the world. Uh, so, David Crosswhite, managing partner at Renaissance Strategy. My background, very briefly, is 30 some years of basically working with large organizations, both inside and outside of healthcare, on in growth through innovation, and that could be innovation strategy, that could be corporate venturing, so to speak, and incubation. And roundabout, started out quite a long time ago in consumer and retail, and since then, at roundabout 2004, started to migrate some of those capabilities over into working with large healthcare systems to apply consumer centricity to become more patient centric and the patient engagement, uh, uh, if you will, challenge. And so over a long period of time, working with healthcare organizations on that, moving into life sciences some to look for new and inventive and compelling models, for to solve all sorts of problems in the corporate venturing world. Of late, the last year and a half, year to year and a half, of course, we're working on deploying all the new tools that are at hand. And some of what we can talk about is some of the, if you will, technology and also techniques in the application of the technology to help uh, folks across the healthcare ecosystem in terms of both at the macro and the micro level. Macro level market engagement and growth, micro level patient engagement, if you will. And so that's what I'm focused on of late, using kind of some leading edge tools and techniques, which we can talk about as we get into it.
Thanks,
Dan.
thanks, David. Dan Karen here, CEO of Health Universe. I see a few of my friends on the call here. Bob Palladino, former CFO of Patients Like Me, Joe Warbington. Uh, he's what's your title, Joe? You run everything in healthcare and life sciences over at Snowflake. So, hello to a few of my friends out there. Um, Quick background: two-time venture-backed founder. I founded a company called Rive Health. We raised 32 million and we built a prescription optimization engine. We price about 300 million drug transactions annually. After that, I hacked an insulin pump. I am a type 1 diabetic. I wear an insulin pump on my shoulder and a blood sugar sensor on my other arm. And as part of an open source community, we hacked an insulin pump. And it became the first FDA approved artificial pancreas that's open source. And so that kind of transformed the whole type 1 diabetes space into automation, right? And showed that collaboration and open source principles can help create safe, robust, automated solutions. And so on the heels of that, I asked myself, what can I build? What company can I found that can really take those two experiences and create something even bigger? How can I really make the biggest dent possible in the world? And I founded Health Universe with that intention of how do I bring machine learning and AI tools into healthcare to address all of the needs, of course, that we face in society today. And so that's really my mission in the world, to reduce human suffering using technology, to bring some of what I've learned through open source principles around safety, validation, transparency, and apply that into the AI world and help health systems and pharmaceutical companies start to integrate some of these state-of-the-art tools into their organizations. So happy to be here. Good morning, good afternoon, and excited for the discussion today.
Awesome. Thank you both. And this is, I don't think you even knew you were going to lead so perfectly into the first question with your points here. But, I think one of the things that we're hearing a lot about is kind of patient trust in AI when we're talking about tools for patient education, diagnosis, patient navigation, improving processes. I mean, it really took decades for patient-reported outcomes, patient-centered design, basically incorporating those patient voices to make their way into pharma, med tech, clinical research. Patients Like Me is a great example of a company that was at the forefront of that. But we now have this new platforms, new tools with AI. How can we learn from that timeline or those mistakes to accelerate patient-centered AI?
David, you want to take that one?
Sure. I'll take a first shot at that. The you know, I think that the acceleration of the use is still going to come down to trust, and I think the trust is still going to be facilitated by the individuals, the pilot in the box, as they would say, right? The individuals who are and this recognize that coming from me, I'm working at it on these topics from a perspective again, either macro level strategies for growth or micro level patient engagement. So if, in our world and in our circumstance at Renaissance, and we've developed kind of a private AI tech called Vibe Check, and we use that to create kind of very, very high fidelity personas and very high fidelity environments that they operate in. So we can run all sorts of simulations as to how are various actors in a play going to interact with each other in that play. So in the patient engagement world, you could think about, what can we do to get patient compliance up? And we could simulate the physician, we could simulate the patient, we can simulate the environment, we could simulate all the external factors that are coming into play. And what are all the scenarios that we could think of if we wanted to get compliance up on, for example, medication use, right? Or medication compliance. That's a real example. And to get back to how we're going to accelerate the use of AI, it's going to be the trust in the players who are, if you will, actually interacting and engaging. So this isn't about, patients necessarily, in my case, patients necessarily learning to use AI. They might, but how can we actually have the professionals use AI to help physicians and use, engage in ways that really help optimize and engage in the broader environment, given that there's all these outside factors of social media and everything else that comes into play. So it's really kind of, to me, still the humans that are going to engender trust and therefore accelerate the use of it in, at least in the context of those types of examples.
Yeah, so I would say I think the big opportunity here is personalization at scale. I think that AI gives the capabilities to organizations to personalize their outreach and personalize the interactions and the micro interactions in a way that's really never been possible before. And so that personalization, I think, is the true engine of the AI revolution here. And so I would encourage folks to think about all of the repeated events that happen at their organization that, if were personalized or customized to the patient, could improve those operational efficiencies, right? Because uh, before that, we were just sending mass emails or mass phone calls, right? Or if you needed to really have a unique workflow, it required a human behind a desk to analyze a chart in order to determine a workflow, right? And of course, in healthcare, those decision trees are enormous and numerous, right? And so now all of those decision trees that are locked up in your organization can be mapped to workflows with AI, because AI is fundamentally about probability. And so if you can, with some degree of confidence, start to map those decision trees using probability, you can start to automate all of those workflows. But fundamentally, it comes from the patient's data and being able to transform that into usable predictive models and workflows. And so I think at the end of the day, you want to think about AI as a tool for personalization at scale. And that's sort of what I would encourage people uh, to I would encourage people to think about AI as personalization at scale, as an easy sort of way to start stepping into it.
I think that's a great point, and I think one of the problems when we talk about trust in AI is kind of the black and white thinking around patients either want that or they don't want that, or that AI should only live in the back room of, our healthcare system. It should never be in a patient-facing um, never be patient facing because patients don't trust it, they don't want it. And I think those kinds of overgeneralizations are problematic. We've done some research recently with some colleagues showing that actually patients, even if they know some medical advice is coming from a bot versus a doctor, that they actually appreciate some of the empathic cues that we can build in that they might not have otherwise seen from a real human who's busy, and so they're more open to, I think, AI allowing
Yeah.
for that personalization than we give them credit for, than we give us credit for as patients. And just the ability to personalize at scale in terms of what language or how things are being communicated, or how risk is communicated in ways that patients can understand, or how we, um, put things in plain language for patients. I
Yeah.
think it's something that, yeah.
I think at the end of the day, people want to be seen. They want to feel understood. They want to be taken care of. And that's why we see the rise of AI chatbots for mental health and even for relationships and for companionship, right? So clearly folks are interested in engaging with AI in these ways that are quite personal. But I think what they really want is they want trust and they want accuracy and they want some level of they don't want to feel like the automation is is cold or just a way to save a nickel or a dime. What they want is they want accurate AI that speaks to their issues, that fundamentally can help them become healthier. And so the way that the patient is engaged through those chatbots requires some element of humanity. And we actually see in a lot of studies that when AI has a little bit of personality, it is more well received by the users. And you'll see this with OpenAI and with Anthropic and how they tweak with every model release, the sort of the feel and the vibe and the personality of the chat. And it's because they've realized that it means a lot how the AI talks to you. And when you engage in some of the voice applications, sort of the tone and how much they push back. And so there's a lot of opportunity beyond just the hard statistics of how do you create personalities through AI that are caring and empathetic, but also trusted and offer guidance. And so I think that's sort of the next phase of AI. It's great that we can sort of personalize a text message or an email or something in a patient portal, or we can grab all the data and figure out which biomarkers are the most important or that are out of range and summarize that quickly for clinicians. That's all wonderful technology. But the next phase that we're going to see over the next few years really is perfecting and crafting the personality of AI so that you feel like, oh, when I engage with this organization, their AI tools, make me feel seen and cared for. And I really enjoy this experience because everything will become fundamentally hybrid with humans and AI systems.
Yeah, and I'll kind of add to Dan, 100% agreement, and I'll add to what Dan said. Like, let's think about that frame in both the patient care side, but with all players in the system, right? Like the patient, the physician, the physician's assistant, the lab draw. Let's think about all those players and how we can leverage that kind of personalization so that not only is everybody benefiting from what Dan just described, but they benefit in terms of how they engage with one another.
So, how do you balance that though, especially with the kind of rapid AI deployment? How do you balance the personalization at scale, the rapid deployment, what AI now is capable of doing that it wasn't even capable of doing a week or a month ago, with a healthcare system that is highly regulated, but also, has a different ethical imperative, different ethical considerations than other industries, right? I mean, getting it wrong when somebody is shopping is a little bit different than getting it wrong when it comes
Yeah.
to, how we're thinking about patients and medicines, et cetera.
I have so many feelings about this question. I see this framed up on LinkedIn every day in what I think is too often an academic lens that really neglects what's happening in the real world with patients. I know as a type 1 diabetic that when I try and get my insulin pumps covered by my insurance company, they are often rejected, right? And everyone knows the problems that exist with prior auth and with denials. And I, as a patient, uh, will be a type 1 for the foreseeable future. Maybe someday there will be some type of stem cell treatment or cure. That would be great. But for now, when I get pushback and prior auth requests every quarter, right? It creates, and that's just one sort of slice. I know folks that, right, you're trying to get appointments and you're trying to just access, especially even in rural areas. And when we see hospitals shutting down and the margins are so razor thin that when an academic sort of posits that, well, we can't really deploy this AI yet. There's going to be, it could hallucinate, right? But studies show that hallucination rates are actually quite low, sometimes in the order of like 2%, which of course you can't screw up high risk scenarios, right? Dosing being one of those. Medication interactions, dosing, things that are high risk need to be labeled as high risk, and that requires human in the loop. And folks struggle with the fact that neural networks don't have great explainability. We can't look inside and see how those decisions are being made by the neural network, especially the foundation models specifically from OpenAI and Anthropic. And that creates a problem, right? Because folks say, well, we don't quite understand how it's making these decisions. But you know what else is a neural network? The human brain,
Mhm.
right? And people negate that in this discussion all the time. And they say, well, we got to have a human there. A human is a neural network too. And frankly, I think one that suffers from more memory issues, more biases, more cognitive impairments. And so I mean, granted, I'm highly biased. I'm, trying to bring AI into healthcare. Um, and I don't want to play down the seriousness of the responsibility that we all bear to do this safely. but we have to match it against real world experiences, and we have to benchmark against human performance, because if I see someone claiming an issue with AI and they're not benchmarking against human performance, I throw that analysis out, because it's not it doesn't it doesn't translate to the real world, because right now, patients are suffering, they're having trouble getting access, clinicians are burnt out. The actual real world boots on the ground experience uh, needs desperate measures. And so I get very heated on this topic. And I do feel that it's actually an ethical imperative for folks to look to these new technologies in order to help fix some of the problems that we see.
Yeah.
Yeah, David, how do you think about that? How does, with Vibe Check, with the wide spectrum unfiltered AI that you were talking a little bit about, how do you think about that,
Yeah.
balancing
Yeah.
that ethical imperative?
Well, I'll tell you what, there's a ton, well, once again, there's a ton, there's a ton that's already been said that I fully agree with, right? We can create, it is absolutely true that we can create synthetics that are not only very incredibly high fidelity, but almost superhuman, right? Like they have we could create a synthetic Dave Crosswhite that has more capability than Dave Crosswhite for all sorts of reasons that we don't need to get into. But you know, totally in line with what Dan was talking about. But we still live in a human first world. Um, it is still up to the humans in the room to be able to do a couple of things. Number one, guide all that appropriately and accordingly. Number one, and number two, one of my colleagues likes to say, like, the key to really helpful uh, productive use of AI is comes down to good questions, right? So you ask really vague, really broad questions, you're going to get you can get all sorts of outside the guardrails answers that you really don't want to be getting or using in any context, and especially in the world of healthcare for all the obvious reasons. So we're still, despite the advancement of capabilities that is occurring week to week, human first with good questions that is guiding and leading is still the key. I think, one of the beauties of all this, of course, is we can do so much more than we were able to do before, but it's still us. It's still us, right? It's not autonomous, and it's a, I don't know if it'll ever get there, but it's a ways from it. But if it is, it's a long way right now.
Great question. So, sitting in my seat as the director of the Center for Health and Business, I say I'm training the next generation of the business of health workforce, right? Maybe not the patient-facing clinicians, but what would what would you say is maybe a under discussed or underdeveloped skill, that there's something that we need in order to meet this next generation of AI in health that, you're not hearing as much about, right? It's not splashing across all the LinkedIn blog posts that you think this is a skill that the future generation, the next generation of the healthcare workforce is going to need to meet the needs of a, increasingly AI integrated world.
I would say probability is one of the more difficult concepts in this space. I think that, I mean, I've taken, graduate level probability courses from MIT, and it was some of the hardest mathematics that I've ever had to study. And it's underappreciated how difficult some of these fields can be. And I think when we move these technologies into health systems and we ask folks who are otherwise very bright people to start to understand, how does a transformer model work, and what is an attention mechanism, and what is a multi-headed attention mechanism, and what is a maximum likelihood estimation, like what is area under the curve? What's an F1 score? What is precision, recall, accuracy? Like some of these metrics, these are performance metrics of machine learning models, right? And what is gradient descent, and how are you adjusting the weights of models? Like people, like clinicians don't have time to understand all this. It's an entire field of research, and it's very complicated. And so it's important for the vendors to understand that you might have a highly performant machine learning model, but you need to be able to translate that in simple terms to end users and to clinicians, and you need to really provide that guidance. And there are organizations and working groups that are trying to make this stuff more palatable and easy to digest. But I would say that, you can go on YouTube and watch some videos, right, on probability and machine learning and watch the basics. And I mean, this is the future, right? This is the hottest topic in the world. And if you go to any events in healthcare, right, every single vendor is AI this, AI that. Whatever anyone has been doing, it has been rebranded with AI. There's just it's it's a fascinating point in time that we're living in. But it takes a little bit of time to understand this stuff. And so I would say learning a little bit about machine learning, even, just looking at the basics. There's a lot of introductory videos. Uh, Fundamentally, it all boils down to probability. And so learning a little bit about probability is going to go a long way. No one likes to hear do your homework, but that's my takeaway.
Yeah, agree. One of my mentors in the space, he started out like the education of AI, education of AI with, the thing you need to understand is most likely, right? Like and in fact, the other thing he would say is, everybody talks about hallucinations as a bad thing, but hallucinations is actually at the core of good AI. It's just a question, you want good hallucinations. So to Dan's point, um, understanding what this is and is not, even at just a very top line level, like that.
Well, that's a great
Um,
point, David. I want to interrupt for a second
yeah,
because
go
it's
ahead.
really important what you just said, is that sometimes when you're working with probability, right, you have your bell curve and you sort of have the average. And when you're working with probabilistic systems and they tend to give you outputs that converge on the average, that's when you can get yourself into trouble. Because if a patient is not of that average, you could start to get into trouble. And so it's incumbent upon the human to sort of also understand when the system might be regressing towards the mean, right? Because that is a dangerous place. But but overall, if the system is sort of converging towards the mean in general, that is a good thing because otherwise treatments or interventions might be not as optimal or not as optimized. So in more higher risk situations, the clinician has to understand, or the user has to understand, when um, moving towards the mean could be a high risk scenario. And so it's a little bit about understanding. That's why sort of understanding probability is so important, because if the system is saying, well, we kind of think it's here in the mean, if you're not there, you got to kind of be careful.
Yeah, yeah. And I think the other comment I would add, Danielle, to your question about, skills that we need to develop, right? Once we understand what we're dealing with here, like what we've been talking about, right? Then you can be a better, I don't even know how to put it, but uh, captain of AI or leader of AI, it wasn't all that long ago when, 9 months, a year ago, when somebody would say, well, if AI is the future, become a coder. Well, now you don't want to become a coder necessarily because it does its own coding, but so somehow, that you can start to acquire the skills of the use of AI as a leader in the organization, and a leader doesn't have to be a C-suite leader, right? As somebody who's trying to help reinvent the patient experience, or on a more specific problem of how can I improve compliance on, on medication. Um, so to do that, again, you kind of need to you need to know how to ask good questions, to repeat myself. And a part of knowing how to ask good questions is knowing what you're dealing with, right? That you're dealing with an is most likely system. So what's it good for and what's it not? And what do you need to look out for? And what do you need to have in the human chain in the workflow, right, to interact with the AI that's in the workflow so that it has efficacy.
Yeah.
And if you're, or so that's kind of at a micro level, or at a macro level, if you're looking to, look for, let's say you're managing, you're in a C-suite and you're managing a system and you're looking for, growth levers and sustainability levers. What are the most useful, what are the most useful applications of AI, and what are not so useful applications? And by the way, in a useful application, what does that look like, right? Again, kind of the human AI workflow, not just the AI workflow. So I think learning to be a good user or a captain of AI is kind of one of the most useful skills now going forward, right? It's there is so much that it can do on its own, but you need to know what you're dealing with so that you don't let it kind of run off the rails.
Yeah, I
Yeah.
would piggyback on that and say, everyone on this call is joined because they're interested in learning more about AI. They're interested in learning how it's being deployed. And so everyone on this call has that appetite and has that curiosity. And I would just say double down on that. I mean, we all have busy lives, but we're living at the intersection of some of the most interesting times in human history. And if you spend a little bit of time digging past the hype and digging past that first surface layer of buzz, and you start to really educate yourself and train yourself on these systems and how they work, you're going to be so much better prepared for the next few years, and you're going to be able to really become even more of a leader in your organization, and you're going to be able to create the kind of change that I think we all hope for. And so what I would say is, don't be afraid of the technicalities of it. One thing that I've done consistently in my life is said, well, I don't understand this yet. It's not that I won't understand it, it's that I don't understand it yet. Yeah, Joe, his 7-year-old is building Streamlit applications, and so it is amazing what's possible today. And so, but take that first layer off and get below, get under the hood. I'll share some links of some of my favorite machine learning educators on YouTube, and I've sent these out to a lot of folks. But once you get beyond a little bit of the base layer of the mathematics, and you can start to conceptualize, okay, I actually start to get it. I understand a little bit more, and it's not just magic. Because if you're just sitting there and you're like, oh my God, this is just pure magic, like what do I do? The reality is that you just have to educate yourself and get a little bit deeper. So the skill really is education a little bit. But once you have that, right, knowledge is power. And then you'll be able to evaluate different vendors. You'll be able to evaluate different models. You'll be able to evaluate where it's safe to deploy this stuff. But it's almost impossible to do that without that base layer of education. And I don't see a lot of that talked about as a requisite skill. We talk about the outcomes and the ROI and sort of the vision for the future, but people don't want to do their homework, right? And ultimately, if you're willing to do a little bit of that homework, and I think we've self-selected with the audience on this call today, you've proven you're willing to do a little bit of homework. Just dig deep, dig deeper. And then once you get, because you can learn uh, I don't know, you can learn 50, 60% of like the main concepts in a field in about a month, which, maybe you can't like execute on everything, but if you spend a month really digging deep with books and YouTube, you're gonna be able to excel in this
Or
field.
programs at Bentley.
Or programs at
You're giving
Bentley.
you're giving Emma her pitch there,
No, it's true. I really applaud Bentley for the great work. I see the folks at Bentley squarely digging into this, and I think it's incredible, and that's why I like to share my time because I see that dedication, and I think that's really important.
And I think it brings in David's point. I'll just say that one of the things, that is so fundamental to whatever field you're digging into, but especially now where it feels magic and it feels new and it feels exciting and there's so much hype, is if you don't get under the hood, you don't know what questions to ask, right? And I was just using this example with somebody, if you know nothing about how your car runs, you don't even know what questions to ask the mechanic, right? And so I think probability is a great example. I think the technology, but I also think kind of the patient side of things too. If you don't know what people think about a new technology, what level of trust they have for it, what their perceptions are of it, what their hesitations are around it at whatever stakeholder level, whether it's patients, whether it's providers, whether it's the system and administrative professionals working in that system, if you don't have a basic appreciation for what their perspectives are, you're not even going to know the right questions to ask to get the buy-in or the right questions to ask to get the implementation to run effectively. And
Yeah.
so, it's kind of that idea of the questions I really like.
Yeah, one at least last word from me on this is it is just so critical to know what good looks like,
Yeah.
to both use and then evaluate what you're getting out of the usage. But I'll go to your hypothetical example, Danielle, of, if you're an auto mechanic or if you're using it to try to figure out how to fix your car. Well, if you don't know the first thing about the first thing about the first thing about any of that, how would you even know how to ask the question? Much less whatever it feeds back. How would you know if it's any good or if it's garbage? And there's plenty of garbage you can get back. So what good looks like, I think, is facilitated by a couple of things. Number one, the type of thing Dan's talked about in terms of knowing what you're dealing with here, right? Like, what is this thing you're using, just at some base level, understanding that. Thing one, right? These are is most likely models, right? Very, very, very sophisticated, but is most likely. And number two, some content expertise always helps, right? So the physician-patient relationship, they know what that looks like, right? That can never, well, not never, that shouldn't be pulled out of the equation, right? In my view. So
I would agree with that too, even though I think there's ways you can augment it, there's ways that
for
you can
sure, which
support
which
it.
which is the beauty of it.
Yeah.
Which is the beauty of it. Yeah.
And, it may cause us to reconsider what it even means to, for example, be a physician, right? That physicians have long got into medicine to heal and to have that patient connection. But they're also folks that, have that kind of diagnostic analytical mind that allows them to understand the human body and past chemistry and organic chemistry, right? And succeed in medical school, which is very technical. And, what does it mean to have a healing relationship when knowledge can come from, a simulation environment, and maybe that'll even change who becomes a physician and how we think about the role of physician or how we think about the role of healthcare environments. And so
Yeah. Well,
I think we
I
need to
think
be open to that
yeah,
as well.
I think
Sorry,
that
Dan.
that sort of speaks to data, right? And so if you're working with an is most likely model, or you're working with AI or machine learning, in general, you have the data that you have at your fingertips from your hospital system or your organization, and then you have pre-trained models which are trained on mountains of data. And so what you're hoping to have is alignment between those two samples. And that's when people say, well, I don't know if this model is going to apply over at my organization. And so when you have a vendor that may have built a model that's trained on some data that may not be comprehensive, well, that may not be representative of the data that exists at your organization. And so the basics, and again, that's a pure sort of statistics and probability um, uh, problem, right? And so you need to understand again the basics there in order to know enough to ask those questions. I did share a few a YouTube channel, Serrano Academy, and Luis Serrano wrote an amazing book called Grokking Machine Learning. It's a little tricky. At the very end, you start to get into some calculus, but it's not actually that difficult. And I would encourage people to maybe look at some of Luis's work because it's very approachable, even if you don't fancy yourself a math person per se. A lot of his stuff is built upon intuition, and you can get the intuition for how these systems work.
So I guess maybe I'll start with David from your consulting experience, and then Dan, maybe you can share as well. Can you share an example, maybe an example that you're most excited about, where AI-driven insights have led to, a specific fundamental improvement in patient adherence or engagement, or optimizing workflow or payer outcomes, like whatever but kind of a specific success example that you're kind of most bullish on, that you're excited about.
No. Gosh, there's some things that I've done outside of healthcare that I'm really excited about applying within healthcare, but are to
That's okay too.
come.
Yeah, that would work.
Oh gosh. Okay. Well, then you just broaden the spectrum of that.
Sorry.
Um, I
Answer however you would like to
Yeah,
answer is
I will
basically.
say, I mean, I've already alluded to it somewhat, but one one ex I, I- I'll kind of repeat one thing I already mentioned, and then project how we could continue to leverage that into the future. That would be really exciting. Which is, so um, how to how to change and enhance patient engagement in ways that increase compliance, which are going to have, which obviously would have. So it was actually, to keep things anonymous, it was actually a pharmaceutical organization that wanted to understand how we could enhance the physician-patient engagement kind of cycle, and understand all the surrounding factors to understand how that affects, or what compliance is today and why. And so we were able to create the synthetics of physician, patient, other players in the play, if you will. And other players weren't always humans either, right? So think social media as one example. Think education for the physician as another example. Education programs. Think education programs for the patient as another example. So how do you actually simulate that entire picture and kind of high fidelity, and then run scenario after scenario after scenario? So compliance is 50% today. Here's why. Now, what are the levers we can pull, and how's that affect compliance, either up or down? And how do you pull levers individually, and how do you pull levers in combination? And the great thing about, of course, AI is you can just do that at scale, meaning at levels that just exceed human cognition capabilities, right? In terms of the number of levers and the combinations of levers, and what are the outcomes. Now, again, back to a point we've been talking about, you need to be able to trust those outcomes. So you need to know what you're dealing with, which means you need humans who know what they're doing, along with an understanding of what the tech is doing. But that was actually quite, to me, that was quite a successful and exciting. But what's even more exciting about that, in my view, we haven't done this yet, but I'd like to look forward into the future, is instead of that's a great question, right? And compliance specifically as it might pertain to meds. Um, but what about if we started to project those types of techniques into the future and look at not sick care, but health, right? And what is it that how is it that physicians and or the systems at large, or even beyond systems? How can you engage, not just, I won't call them patients, how can you engage humans to think about health, right? Not sick care, but health. I won't even call it prevention. I'll just call it health to start with, and all the kind of ripple effects and ramifications. And the tech really does have the capability to go there, right? We just haven't kind of run that cycle yet. But the tech has the capability because going back to sort of the superhuman capabilities. So I'll stop there. That's one exciting example.
Yeah, I would say from my perspective, what we're most excited about, what we're seeing tremendous sort of uh, excitement and results around is summarization, right? AI models are great at translation. And so when you have a bunch of data, structured or unstructured, and you have to sort of marry that and summarize it, AI is pretty good at that. Every now and then it'll make a little minor mistake here or there.
Mhm.
But in medicine and healthcare specifically, you have patient records, you have tons of structured and unstructured data. And how do you take that and mutate it and transform it into a way that's useful for the task in front of you, whether that be filling out a prior auth or getting up to speed on a cancer patient's history, right? There are many instances where you have to take a medical record and you have to mutate it in order to extract some information. It could be filling out a registry work, something we do. It could be patient health history summarization, we do a lot of, or just giving the patient the ability to take their entire medical record and query it and ask questions, and really having those little summaries and being able to communicate at different reading levels or in different languages or in the format that's needed at the moment. At Health Universe, that's what we enable, right? Taking all the medical records and then we process that down into a format that we spent a few years building, and that format can feed all sorts of agents downstream to take actions at any moment where that's necessary, right? So we enable automation over that summarized patient record. And so for us, that opens up tons of avenues, right, for people to take action, whether it be reaching out to a patient and engaging them and saying, hey, we're noticing your A1C is creeping up. Let's have you in for a visit, or treating them like a human and talking about nutrition or whatever that may be. But being able to identify areas where you need to improve and being able to outreach in a personalized, controllable way enables sort of operational efficiencies at scale that were just never possible before. And so that's what I'm most excited about, right? Because it means that we can get, I think Pia said it earlier, AI has the ability to prevent delay in care, right? And so we work with a lot of cancer centers. And if that means being able to summarize a case faster for a clinician to determine the appropriate interventions, that can shave a lot of time out of the process. Or you can identify things where, hey, maybe we need to get this lab work done because of X, Y, or Z and intervene sooner and more efficiently at scale. And that ultimately, at the end of the day, means that we can help save lives and improve health. So I think it's the scale of what's possible keeps me and my team excited every day.
I think the fact that democratization and consumerization in healthcare have a history of being seen really negatively, right? That but yet we're talking about patient engagement and patient empowerment, which are kind of the positive spins on those same concepts. And I think there will be kind of a movement towards ensuring that AI frankly enables more patients to have access to these complex concepts, right? I mean, right now I could ask AI to tell me a little bit about probability models in AI, and it would give it to me in a way that I
Mhm.
could understand. And the same thing could happen, if I'm a cancer patient deciding between two really complex treatments,
Yeah.
or appreciating, why adherence to those treatments is so vital,
Yeah.
and making sure. And, it's maybe one of the situations where we can see a win-win-win between the system, the payers, the providers, and the patients.
Yeah. One
And
fun
s-
little
You know,
one fun little thing to do with some of these foundation models is to give it some data and then ask it, what are the patterns that I might not be seeing? What are the things that
yeah.
are not the average here that I might need to pay attention to? And that sort of gets you away from just the mean and starts to explore some of the things that are a little bit further out on the curve. And that is also a really interesting little thing for, I think, folks on this call who are starting to learn about AI and how to use it. That's a fun little technique that ties into what David was talking about, is most likely. Well, how do you break out of that a little bit, and start to ask those styles of questions, frame it in a way, where you're asking it, hey, what might not I be seeing here? What might be sort of not of the norm?
One other topic, or one other related topic that kind of an obvious point but shouldn't go unsaid, I think, is we're talking about all these better outcomes that we can affect, which is terrific. Honestly, some of the great news too is, and Dan's talked about efficiency in terms of speed, 100% true, but also efficiency in terms of man hours and people time. And I'm not suggesting at all, let's let people go, but we are all in the healthcare world, we are all feeling the pinch, right? From the history of healthcare and over the last X amount of years, and it continues today, everybody's feeling the pinch of having to try to operate and do more with less. And it obviously affects that, right? Not only the speed, but you know, it's you'd like to hire 5 people, but you just don't have the budget. Well, this helps, right? So let's not have that be lost on anything as well.
Great. All right. Well, I want to let Emma jump back in here, but I want to say just thank you so much, David, Dan, and everybody on the call. The comments and engagement have been fantastic. And I'll turn it over to Emma to give a final thank you as well.
Well, truly, thank you so much. What an interesting conversation. I hate cutting it off, but I know everyone probably needs to run to other things. Thanks, everyone.
Thanks, everybody.